which she emphasizes is the issue of drug abuse and intoxication with various products. Our observations are that we have a significant number of health workers who are living on drugs. It is your duty as leaders to look out and prevent this vice. You have got to help people not to go into these intoxications, and if there are those who are already on drug abuse, identify and have them helped, because the end result will be a bad one. The clocking, she emphasized the issue of duty rosters, where you are only supposed to pay a person who has worked more than 15 days in a month. If someone has worked less than 15 days and that person is paid, the person who is paying is going to answer. I hope the DHOs, you get this, because I think that is where you click for me to get my salary. So if you are a health worker is under you, has worked 14 days and you are paid, you are the one going to be punished. So take care. The minimum number of days, is 5 days a week, which is 40 hours in that week, and that means that averagely in a month you are working 20 days, but public service allowed up to 15 going onward. So a person should be able to offer a service to that. We have. There should not be a situation where a patient comes and this time this clinic is attending HIV, then you refer to another clinic maybe for hypertension, or you refer for treatment of malaria. She says, DHOs, you have got to take lead and see that the integration is done, and this is the holistic care which we must take. The second one is critical staff recruitment. We must ensure that the critical staff are recruited and prioritized to benefit from the wage, which any extra wage which comes up, the critical staff must be in. All districts have been directed to ensure that they have substantive DHOs, and that is clear. Anesthetic officers are missing in most of the facilities, and the government also has ruled that we must be having the medical officers at the facilities, we must be having the anesthetic officers, we must be having the midwives, those as critical, and then add other staff. But for minimum functionality, we need that effective. Members, I don't know whether it is the way people are being trained now, but we have observed as we supervise health facilities that people have forgotten what they are supposed to do. So the DHO, the medical officers, the nursing officers, assuming they are all well skilled, must enforce clinical skills within the health team. If you identify someone who is weak, please have these people mentored so that standards are upheld. We noted that some people even treat someone without even knowing whether, they don't do any clerking. You just enter and says, oh, ulcers, puts you on treatment. Oh, cough, go and do ZA. Or gene expert. So there is nothing clinical which is taking place, and PS is serious on this. Members, of course, I don't have the regional hospital team here, but things have moved there. Nobody is going to be promoted. If you are a medical officer and you need promotion, there should be outputs to justify. It is not the good English you are going to speak, the good recall of your medicine which you are going to present. No, the commission is going to interrogate you. What have you done with your great knowledge? That means that if you're a medical officer and you are supposed to conduct ward rounds, how many have you conducted? If you are supposed to see patients, how many consultations have you done? If you are supposed to do operations, how many have you done? If you are a specialist, have you participated in these activities, or you are just coming to check and let others go? So it is important to that effect. Then the
Mark ranked in such activities. Mr. P.S., I want to inform you that we have a motto at the cultural institution that when you don't involve us, you don't get involved. I want to salute Minister of Health through your teams down here that have always involved us in many of our programs. The other time, the PS here trained our grand family on matters of malaria in our community. So we want to thank you. I want to thank you on behalf of the government programs. Now, if we don't come closer to each other, we are not in touch. We may not know what is happening. It's good that we've been involved right from the launch of malaria or something in Usamaga. The DHO for the Valley City, Dr. Ngonya invited us and we have been part of it. If we have a key which is gazetted by government under Article 246 of the Constitution, in line with the Cultural Leaders Act 211. If you are from a neighboring community without a key, you can make use of our cultural leader. I've seen some districts, if you don't have service commissions, they can borrow from a neighboring what? Neighboring district. Yes, that one you can take it. One, we want to fully associate ourselves with such a program. Treatment in the past was not an issue to do with the medical treatment. If you fell sick in the past, you only needed to consult a witch doctor about your sickness. Others will touch the garment of Jesus to have their diseases healed, or be attached to that your diseases went away. But of course, now there's evolution. You need practical hands-on, what you call psychomotor. Somebody must attach you to examine and find out what is harming you. I've also noted with some level of sadness on behalf of the institution. We still have some isolated cases of maternal mortality rates. You get them, you hear them. People come to us and tell us there's maternal mortality rates still in some places. Sometimes we even find the health center 3, 4. It's doing very excellent work, more than the seniors. We were confronted with a situation where somebody, a certain hospital, refers patients to a clinic. Somebody is brought from Buda to say Barren Fado or Barren region. You a doctor, you want to refer him to a clinic because you have interest in that what? That clinic. I think for us as a cultural institution, we feel that is very and welcome. We have also noted some element of zit break, where people abuse the Hippocratic oath. You find a doctor discussing the patient, the status of his patient that is treating. The other time when the president himself in part of the university, and told the message there was a sick man, the message said, you and me who knows who is what? Who is sick. Let's, as professionals, ensure that you don't disclose information that comes to you. And I think it is also covered under the Geneva Convention or something like that. You do not need to reveal information to people that come to you. I was also looking at issues of medical negligence. Somewhere, in fact, is on the rise as a cultural institution. We encourage you, we enjoy you to exercise more caution when you are treating our people. We appreciate that you are treating, we appreciate that, but exercise extra caution. there was a disturbing case, I think in Murago Hospital of Sarah. The PS, I will encourage you with your permission, sir. I want now, I'm also a lawyer, I want to tell this team to read medical negligence cases. Just go and read them. For example, Sarah Otsemwa versus the Attorney General. Where a lady goes to Murago Hospital for treatment, another for birth, and she was due for labor. She goes there, and a nurse, just from nowhere, of course she was inducted on labor, and yes, to ensure that the cervix is dilated reasonably in order to give birth. But at 6 centimeters, the lady pricks the membrane. And what happens was a cord prolapse. The cord comes out. You know when it comes out, I'm not an expert on that, but there is an element of loss of oxygen and the child cannot die. So let's ensure that as a medical professional, you know when to break the membrane. Otherwise, if it's 6-5 centimeters, you might bring what problem. So there are sufficient case law cases on medical negligence. Right from there's a minister in India. The minister went for treatment. His leg was good. This was the good leg, the good one. Now this was the sick one. Now instead of amputating the sick one, they went for what? The good one. That is negligence. Under Section 187 of the Penal Code, there is a punishment for what? For negligence. So, our team is here. They have read medicine. You see, there's no dispute on that one. But I have not read law. Let them read cases of medical negligence. Then we say, hey, you mean somebody did this? Read them, they are sufficient, they are very many. You can Google them. Somebody has failed to attend. You know, when you medical negligence occurs, you bring problems to government because they will sue the government, isn't it? So the Attorney General what you call a vicarious liability offense. At your level, you know vicarious liability is a crime committed by one person and you arrest or you punish a senior or you sue government for that vicarious liability. So you increase costs and governments may not have sufficient enough resources to pay. You can read about the Nakaseke District Local Government, Nantes versus Nakaseke District Local Government, very many medical cases. And once you are guided by that, perhaps it can also help to shape. Otherwise, we wish you well.